So you've torn your ACL. Inevitably, this is a difficult time where patients have a lot of questions. At Therapia, we've put together this video to help you navigate your recovery and get the best possible outcome. The first question that most patients have is, do I need surgery? And the answer is maybe. Not everyone who tears their ACL needs to have it repaired. Following a well-constructed rehab plan, many people can return to all of their activities without having surgery. The question we need to ask is the knee functionally stable enough to do all of the activities that you normally do? Functionally unstable knees will give way or collapse when you plant your foot and try to pivot or change direction. These instances of giving way may be present at first and then go away after your swelling goes down and your physiotherapist teaches you how to get your muscles properly supporting your knee. If your knee continues to give way, even after the swelling is down and your muscles are working well, this is a good indication that you will need surgery. Each time a knee gives way, it's a subluxation of a tibia on the femur, and it can potentially damage your other cartilage as well as your menisci. If you participate in sports like soccer that require cutting or rapid changes in direction, there's a higher likelihood that you'll need to have your ACL reconstructed. If you participate in sports that don't have cutting, and after the initial rehab phase, your knee stops giving way, then you may not need surgery. For more detailed information on the surgical reconstruction of an ACL, please have a look at the great video by Dr. Jaz Shahal entitled ACL Reconstruction Surgery. An ACL rupture is a significant injury, and its reconstruction is quite invasive. You will need to commit yourself to a lengthy rehab process. It takes about a year for patients to feel like their knee is normal again, and at least 6 months of intense rehab in order to return to sport. Your physiotherapist will guide you through this rehab process using established protocols, as well as considering your specific needs and your response to treatment. Typically, people are sent home from the hospital with crutches and a leg brace that keeps their knee straight. Over the first 2 weeks, you'll be managing pain and swelling, as well as beginning some gentle exercises to restore joint motion and muscle function. Most patients are able to stop using crutches and return to work or school within the first 2 weeks. This, of course, depends upon your specific job. After 2 weeks have passed, much of the pain related to the surgery will have stopped, and your physiotherapist can be more aggressive about restoring joint mobility. It's particularly important that your physio helps to regain full knee extension or straightening at this time. After the 6-week mark, restoring extension mobility gets more difficult. In addition to the manual therapy, your strengthening routine will become more intense to restore quad, hamstring, calf, hip, and core strength. Over this time, the focus will be on muscular strength, muscular endurance, proprioception and balance, joint range of motion, and functional exercises. Your physiotherapist will progress your program based on how your knee responds to the increase in stress. It's critical at this time to increase your exercises appropriately to avoid having your knee swell up and create a temporary setback. It's around this time that most patients start to feel really good, and a certain percentage of patients will feel like they can do quite a bit more than their physio is allowing them to do. For this reason, a percentage of patients will go out and do things that maybe they shouldn't do, causing the ACL to either stretch out or rupture. It's important to understand that the restrictions on your activity have more to do with your ACL's readiness to accept stress than how you feel physically. Most patients are cleared by their surgeon and physiotherapist to begin running at the 3-month mark. Remember to start slow and watch how the knee responds to the new activity. If you're waking up the next day swollen or stiff, it's an indication that you've done too much and to dial it back a bit. Your physio can help you navigate this time. This is when the rehab starts to feel more like training for sport. Your exercises get tougher, and you'll feel as though you're getting stronger with each passing week. The focus during this period is functional exercises, single leg exercises, proprioception and balance, plyometric or power exercises, and sport-specific exercises. Most patients can return to sport between 6 and 9 months after their surgery, depending upon what type of ACL graft was used and your particular surgeon's protocol. Just like the return to running, return to sport is done in stages while monitoring the knee's response to the new stress. A good way to think about the stages of return to sport is conditioning only, conditioning in drills, drills in scrimmage, and finally, return to competition. For people returning to non-competitive activities, your physiotherapist can help to create a plan with your specific goals in mind. Not everybody returns to sport at the same level that they participated in prior to injury, but the vast majority are physically able to if they stick to a great rehab plan. Between 5 and 10% of people who undergo an ACL reconstruction will tear their graft eventually. Ongoing training of the core, hip, and leg muscles can help reduce your chances of re-injury. It's important to have your physiotherapist teach you these exercises before your rehab plan is complete. I hope this video was helpful and gave you an idea of what's in store